This is KLEAN Radio.
This event is so important now, even more than it was 3 days ago with the death of my friend Robin Williams. People have to understand what addiction is, what depression is, what sobriety can be, and that there is a solution, there's a way out.
And that was Pat O'Brien. Welcome everybody out there to KLEAN Radio. That was an event last week held at Royce Hall. And yes, you've just tuned in. You are listening to KLEAN Radio. In studio is Andrew Spanswick.
Good evening, Judah. How are you?
Amazing, actually. And we have a great show for you tonight. We have a great guest. But before that, and that was Pat O'Brien talking a little bit about mental health and addiction. And obviously in the news all week long, the sadness, and I texted you the second I saw it about Robin Williams, and your response was unreal. And you're in the industry. Yeah. And, you know, and we've been talking a lot about this, you and I, and I don't know what the solution is. I just know that every time an addict dies or it's always in the press. We don't hear about the good stuff. We don't hear any of the good news. We don't hear any of the progresses. We don't see, you know, we go bowling every Wednesday night, and if the media is out there, I don't think I don't think people want them to come and follow us, but 40 people that are sober now go bowling in Jerry's at Pins in Studio City in the Valley, and not enough is being shown about the progress that people are doing through mental illness.
Well, one thing that I was really sort of impressed by was Robin Williams' family, who said, you know, we don't really want to have everybody discuss about necessarily his suicide, but more celebrate his life. Yeah. And more than that, it was also part of that, I think, is that he obviously had been suffering from a lot of problems for a long time that everyone knew about: cocaine addiction, depression, and now we found out through the family that he had early signs of Parkinson's that he hadn't felt comfortable announcing to people yet. And, you know, his life, someone that was that, you know, going through so many issues and yet that successful still. And there's 3 movies that haven't even come out yet that he's completed that haven't been released since his death. So, you know, it's like, it's important to see how many times he's struggled and he's still held on. Right. You know, the fact that he chose to kill himself at well, I was 62, I think. 63 is extremely unfortunate. But, you know, he was obviously dealing with a lot of demons and a lot of problems. And it probably got too much for him. And, you know, that can be tough.
And if you just tuned in, you're listening to KLEAN Radio. Our hashtag tonight is Out of the Shadows. And the reason I bring that up is because so many people, Andrew, are struggling out there. And I think people get scared off when they see the Robin Williams thing. I think, you know, or the Philip Seymour Hoffman, the horrific things that happen. And I think people could go, oh, it doesn't work. You know, because with every...
Well, I mean, those 2 examples in particular remind me always that, you know, if you're an addict at that level, you're engaging in suicidal behavior at that point. You're already risking your life while you're using and risking other people's lives sometimes. So, you know, if you're that impaired at that point, you're well beyond the point of whether suicide's even an option. You're already engaging in behavior that's killing yourself. So people need to recognize that depression and suicidal ideation and drug addiction all share some common features.
Go hand in hand sometimes. Yeah. And so if you're out there and you just tuned in, you are listening to KLEAN Radio. I posted today on Facebook. I wanted to hear success stories. So I posted it to people on Facebook, share your birthdays with us.
Yeah, we got an overwhelming response.
We have an overwhelming response of people. So throughout the show, we're going to be reading people's birthdays off. They actually gave us permission, and I won't say your full name, so don't worry. And so give us a call. The number is 800-222-5222. That's 800-222-5222. Our hashtag tonight is Out of the Shadows. If you're struggling out there or you're doing well, I want to hear from you tonight. People need to hear from you. People need to hear from those of you out there that are doing well, because I know there's so many of you. And sometimes even people like us, we need to see that. We need to see the people that are doing well. And I think people in our society need to, and we want to hear your voices, because I really believe that's one of the solutions, is everybody out loud saying, I'm doing okay. I'm getting better. And it's not always 100%.
And even if you're not there yet, I mean, that's one thing that we really want to talk a little bit about on the show tonight is harm reduction and the idea that maybe you're not completely sober yet, but what are you doing to get better? And, you know, some people are looking at alternative ways of dealing with addiction or drug abuse or misuse. And they're learning ways to moderate their usage, which is a very controversial subject, of course, in the addiction community. but it's certainly something that I think we could discuss with our wonderful guests.
Yes, that's right. And so give us a call. The number is 800-222-5222. That's 800-222-5222. We do have an amazing guest. She's a doctor. Her name is Dr. Stacy Cohen. She's also the clinical director at an amazing program in Los Angeles called Beit. And she's got a fascinating story. Welcome to KLEAN Radio.
Hi, thank you, Judah.
Welcome. And something really interesting is you were originally a surgeon.
Yeah, that's true.
And what happened?
I like to say I'm a recovering surgeon. I guess
so
what
you're in
happened,
recovery, so everybody knows
in
that.
recovery.
Yes.
I guess what happened kind of starts sort of from my childhood. The reason I went into addictions is a long story, and the story starts with my father. My father came from a family with not a lot of money. He wanted to make a life for us, and he wanted to make a lot of money. And so all I heard all day, or all I felt I heard all day as a child, was about money and arguments and about things I didn't find very important. So I'd watch TV, and I loved seeing the kids with cleft palates, and I was just a really sensitive child. So I really thought that I wanted to do something important. And I remember those commercials so well. I saw kids with AIDS, and I saw kids with cleft palates. So I got to college, and I was pretty smart, and I knew I was going to be a doctor, and came from a Jewish family that always was pushing us to overachieve. And so I went to college, and I majored in medical microbiology and immunology, and thought I'd want to study HIV and AIDS. And then I realized that really wasn't where I wanted to go, and I thought surgery would be a little bit more exciting. I was a little more creative, liked working with my hands, didn't like textbooks as much as I liked doing things. So I get to the point where I'm applying for medical school, and I started to realize that the mind wasn't something that we were learning about a lot. And I thought psychiatry might work for me. I wrote some things in my essays about being a psychiatrist. And then I'm in medical school for a few years, and I had a relationship with someone who had trouble with alcohol. And when that relationship ended, I wanted to be as far from relationships as I could be, and I decided I needed to be somewhere where I'd be locked in and scrubbed in, and nothing could touch me that would be difficult or painful, and that place became the OR. I matched the University of Chicago. My parents bragged to everyone it was the most exciting thing in the world. It was my first choice, and I couldn't be more excited to be a surgeon. And about 6 months in, I realized it was a really unhealthy profession for me. It wasn't the right fit. And I realized that I was doing it for a lot of reasons that were external, to please other people, also to escape from my own fears of dealing with some of the things that I really wanted to be dealing with, both for myself and in the world. So about 6 months in, I decided I should switch to psychiatry. At that point, I was totally confused. My parents were very terrified that I was going to be a psychiatrist and my kids were going to be crazy. And I realized how stigmatized the profession still was. And, you know,
And that's funny, because that's from somebody that actually wants to be in it, that you thought about that.
Well,
I mean,
it's true. Like the old saying is that psychiatrists have the craziest kids, but I think people are getting around that now.
I hope they're starting to. So yeah, pretty quickly I switched, and I realized I worked through a lot of my own problems, and I realized pretty quickly that mental illness was something that wasn't getting enough attention, that I needed to be working on. And I worked in a professional program, professionals with addiction. They call them paired professionals. I think they're working on changing that title, but I worked in that program, and I saw a lot of similarities with not only the people in the program, but myself and the experience I had had in the relationship. And I realized it was something that I really wanted to do, and then I started sort of expanding to treating more than professionals, and now I treat over 100 people at a large residential facility, and I love what I do.
So what's your sort of central modality or type of treatment that you provide?
So, I mean, I've always believed in an integrative model. Although I'm a psychiatrist, and these days psychiatrists are associated with psychopharmacology and medications, I don't really believe that that's what the role of the psychiatrist should be or is meant to be. I think we're supposed to sort of be the conductor of the entire team, including psychotherapists and counselors. And in addiction specifically, we wear a lot of hats. these days, when you work in the addiction field, there's multiple ways to work in it. You know, you can be working in a research lab and just sort of be trying to figure out the biology of the brain. You can work in an outpatient clinic and be seeing people for 30 minutes a few times a week. When you work in a residential setting, you really need to understand people and the core of the issue that addiction's about. And it's generally not just a biological problem. It's a whole lot more. The family's involved. The childhood of the patient becomes a central role in treating them, learning about who they really are. So, you know, my treatment modality is an integrative one with a big team.
It sounds though like you're partly into the resurgence of psychoanalysis.
Yes. Where I trained in my residency, it's one of the last standing, very psychoanalytically oriented residencies.
Okay, so to the people that just tuned in, you are listening to KLEAN Radio. Why don't you explain a little bit about you guys are even over my head here, okay?
Well, there's different, so there's different types of therapy, and Freud, of course, came up with psychoanalytic theory.
Of course, to you, yes, but not to everybody.
Well, and it's changed significantly since then. There's branched into many types of therapeutic models and beliefs, but then not opposing, but sort of the other major branch came from Jung and all that group, and they went into cognitive behavioral therapy and basically brief therapy and dialectical behavioral therapy. All these things that try to change behavior and thoughts in the present. They don't go back like psychoanalytic theory that tries to look at the development of the individual over time from even pre-birth, like back in their mother's womb, and issues with the parents that can then be transferred to the child, and then how the child expresses them throughout their life. Well, cognitive behavioral therapy would just look at why are you acting that way, and then try to make you think differently and then act differently. So they're very, very opposing sorts of ways of looking at people, but you can integrate them into using, say, cognitive behavioral therapy for, say, obsessive behaviors, right? If you have OCD, obsessive compulsive disorder, and, you know, so you might use that, but then you might also look at why the person has a lot of anxieties that are underlying that expressive illness. And so you might use a psychoanalytic approach to get deeper into what's going on in their whole life from when they were a child on up. So is that good?
Yeah. I mean, the only thing I would say is I don't really see them as opposing. I think that sort of the same way that we can all, a lot of people can look at spirituality, but talk about different religions that they use to speak about their spirituality. I think that the core purpose is sort of to get to the center of the dis-ease, what's going on. And I think that all the realms of psychotherapy are sort of looking at the same piece, but speaking different languages.
Right. I think I was thinking more like academically, you know, than actual practicality.
Yeah, absolutely. CBT is seen as sort of in opposition to psychoanalysis.
Just so you know, you are Andrew's dream guest, because there is nothing Andrew Spanswick enjoys talking more than about this stuff. And if you just tuned in, you are listening to KLEAN Radio. Tonight, our hashtag is Out of the Shadows. And if you just tuned in, you could obviously hear we have two very intelligent people, and not me included, in the studio that could really help you out tonight. And the reason I say that is because
we're just going to analyze you, Judah.
God.
It's going to be 2 against 1.
I'm in trouble. An hour, I don't know.
Right.
And I'm in a lot of trouble. And
I'll pay your billable rate for the hour. We'll be fine.
Oh God, that's for a different. We'll reschedule that show.
Okay.
We'll set that up in a while. Okay, so before that,
we might have to record that one and edit it.
Please do. We posted before the show. We posted before we were going to celebrate people's birthdays tonight because we think, you know, we're all in this profession of seeing so much sadness sometimes. And I think the happiness is so important to share sometimes too. We have parents out there that are driving, listening at home, in treatment centers sometimes, listening to the show, and they need to know that there's hope. So let's go. Joseph Hill, clean and sober since, since 1996. Trevor P., sober since June 12th, 2013. Joseph H., clean and sober since 12/14/1947. No, that's his birthday.
Wow.
I think he actually put his real birthday in. Thank you. And if you
maybe you never drank.
That's exactly right. He's 64. Thanks for sharing your birthday with us. And so, you know, one of the things that Stacy Cohen, Dr. Stacy Cohen from Beit the rehab, one of the things we were talking about is, People get angry at drug addicts. People are, they get angry at people with mental illness. And I think that's a big reason why the stories about mental illness and the stories about addiction are so negative, is because even though that it's a disease.
Yeah. Well, I remember you called me this week and you were really disturbed about this. And you said, why don't people get angry with people with cancer? They do tend to avoid them, by the way, which is kind of a strange thing. Like it's somehow they're going to catch cancer from people. So there's less of a stigma with cancer now than there used to be. But people are more willing to openly discuss it, which is great. But, with alcoholism, there's a lot of what we call externalities or unintended consequences that come along with the abuse of drugs and alcohol. And a lot of that's like drunk driving and hitting people and killing them and getting in accidents and fights. And
the cancer patients never do.
And destroy. Well, hopefully not. I guess it depends on the kind of cancer. But actually, well, I'm not going to get into that. But there are brain cancers that people don't realize. But yeah, so I suppose there's a small percentage of people that might do something like that. But obviously in addiction, it's much more prevalent that there's very destructive behavior to the family and to the environment and people around them. And so people get very angry about that. And that creates some of the additional stigma beyond the fact. I think if, you just said, okay, alcoholism and addiction is sitting there and it's a problem they have, but it's really just affecting that person, I think people would be more accepting of, providing treatment for them. But all of a sudden they just want to criminalize it and punish it because there are such direct effects to people while people are using.
Absolutely. I mean, I think if you look at obesity, that's a perfect example of something that's simply self-destructive and not necessarily with consequences. Unless
you get sat on,
Look at this therapy humor you guys got going on here.
Well, have you ever been in coach with someone 400 pounds? I'm just saying.
Yes.
Barry almost squashed me. We could call him right now. He'd tell you all about it.
But for the most part, you're hurting yourself, and society has no problem talking about it all the time. I mean, we're seemingly obsessed with the way we eat and the struggle of how to eat well, and that's something that's on the news all the time. It's in every commercial and every TV show, and it's an everyday conversation. And yet I was speaking to my parents. They wanted to know so badly what I thought about the Robin Williams thing, and I said, I think he's a person like everyone else, and this is something I deal with on a daily basis, and we all have our demons.
Sure.
We all have our issues.
And one of the things I think is really interesting, Andrew brought it up, and it's something we wanted to talk about a little bit, which is harm reduction. And he died at 63. Mm-hmm. There were a lot of years of ups and downs, but he survived a long time. It's not a total failure of, he lived a long time.
That's what I'm saying. He suffered cocaine addiction. He was sober for a long period of time, and he had a horrible divorce. And
divorces,
he had so he had a lot of ups and downs. He relapsed a few times, and for a long time he was coming back. He did some of his best work, I believe, in his later career. It's funny how different people at different ages know him for different things.
Exactly. Sadly, some people will know him for Flubber. Or Jumanji.
You know what? I think they both still made money.
Yeah, it's exactly. But
I like Jumanji.
You see, exactly. Let's go to
target audience.
Let's go to Shauna calling from Vancouver, Washington. Welcome to KLEAN Radio, Shauna.
Thank you. You had said that you wanted people to call up with their hardships that they've been through and how they've survived it.
Sure.
Absolutely.
Please.
I'll be 54 in 2 weeks, and I have been widowed 3 times, and 2 of my husbands have died in my arms.
Wow.
And the way I survived it was, let me see, most of my life has been spent grieving. And the way I have survived it is I grabbed a hold of my Bible and I held on to it until I could finally breathe. Mm-hmm. And then 2 or 3 years later, when I could finally get back to functioning, I would set about reinventing myself. And
sorry, go ahead.
This time, instead of everybody is telling me, well, just go down and get a job and you'll get back into life and do it that way. Well, I'm worth more than minimum wage job. Granted, I'm not educated and I don't have all of that, but I'm worth more than that for the way they treat people. And so what I'm becoming is a real estate investor.
That's great. Wow.
I decided that I would just flat get out of the way and do something that scares the skin off of me.
Every week on this show, we hear new terminology I've never heard. Somebody say, scare the skin off me.
Wow,
Rand, we're going to have to actually save that clip of somebody saying that it scared the skin off me.
Well, I think this is great.
Yeah.
I mean, and this is what a lot of addicts face as well. Obviously, death of a spouse is probably one of the most horrible things that can happen to somebody, and to be widowed 3 times must just be, I mean, I can't even imagine. But the idea of like reinventing yourself, and that that you can't just hold on to the past and you have to move forward, and that can be one of the most overwhelming struggles I think a person can face. And people that face addictions have a similar thing where they've lost something. They've lost their spouse often. They've gotten divorced. They've lost their job. They've lost pretty much everything in their life. And they're also developmentally delayed from when they started using. And so that's really encouraging words to say, you know what, take some time, figure it out, deal with the grieving part. But at some point, you sort of have to pull yourself up and decide to reinvent yourself and create a new identity for yourself. And it's really, you said you were in your 50s, I guess, or something, but to reinvent yourself at an older age, it used to be a myth that, you can't do it. You can't teach an old dog new tricks. And what we're finding out now is that as people are living longer and longer, they're having 3, 4, 5, and now it's 8 careers in a person's lifetime.
Is that a hint?
So,
Thank you. And if you just,
no, Judy, you're safe. You're still on career 19, I think, right?
Yes, after the Wienermobile. Thank you. And if you just tuned in, you are listening to KLEAN Radio. We have an amazing show for you tonight. We have Dr. Stacy Cohen from one of the finest establishments. It's called a place called Beit. It's a treatment facility in LA. We have Andrew Spanswick, of course, and we have tons of callers, tons of guests. But one of the things I wanted you guys to talk about, because I actually hear this a lot, and people don't realize this. You often hear people say, "Why are so many more people mentally ill now? Why are so many more people addicts now?" Mm-hmm. And I want to get this answer for both of you, because I think Andrew, what you just said, people are living longer.
Right.
People weren't planning on 63,
well,
50
we're actually
years
seeing
ago.
new diseases.
Yeah.
I mean, we're seeing diseases in older people that we didn't see before because they would die.
Yeah.
And also, I think people that were addicted at 60, they just be, oh, well, let grandma drink herself to death. She's only going to live a couple more years. And now it's like, oh my God, she's going to be able to live to 90. That's 30 more. That's 30 and drive, right? So it's 30 years we're going to have to deal with. I mean, you must be seeing this as well, that there's...
Well, yeah, and there's a lot more access to drugs. There's constantly new painkillers on the market, and painkillers are prescribed at rapid rates. And finally, it's getting some more attention in the media. So, and we're a country of excess, so we like to do a lot of things. So, yeah, I mean, I think that we're seeing more. I also think it's coming out a little bit more, which is good. There's more attention to it, and people who were keeping things undercover before aren't as much anymore. I come from Chicago, and I felt like things were still a little bit closed off there. But then in LA, at least people talk more about rehab, and it's sort of a badge of pride, which rehab you went to, which is great. I mean, it needs to be talked about. We are a rehab-centric
culture.
We definitely are. But, again, so many of the people that are out there that are listening have never heard of this stuff before. Right. We live in LA. We're from Chicago, or we're from New York, or in your case, Ithaca. And
I was actually born in Cambridge, England.
Yeah, I know. Majority was Ithaca, but we often forget that so many people out there are in the shadows, and that's our hashtag tonight. There's a reason for that, because so many people in Middle America, in Washington State, or all over, don't know what we're talking about,
or they think it's normal. You see multi-general addiction where families believe that excessive use of drugs or alcohol is a normal way of living, and they don't know another way to live.
And if you just tuned in, you are listening to KLEAN Radio.
Well, we were listening.
You're still listening? That's my bad. Totally my bad. And we're going to keep on reading your birthdays through the night.
I want to hear more about the Wienermobile, because I can't believe that
I never drove a Wienermobile.
Okay, all right.
And
because I've always wanted to actually see one of those in person. So
you know what? I will actually, for your future nuptials,
yes.
I think we have to have a Wienermobile there.
A Wienermobile
and
at my wedding?
will be driving it, yes.
I want you to parachute into the wedding, by the way.
You know what?
Yeah.
I'll do it.
You'll do it?
Yes, for you.
That's on the air.
If that's the cure for mental illness, I'll parachute it to every wedding. Whatever gets us viral. The Judah, parachuting.
There we go.
Discussion continues.
KLEAN Radio.
Are you or someone you care about addicted to drugs or alcohol? Addiction ruins lives and destroys families. Bring an end to the pain and suffering by calling KLEAN Treatment Centers. KLEAN has helped people from around the world break free by not only treating the addiction, but the underlying causes and providing vital aftercare so people can get clean and stay clean with no gimmicks and no false promises. If you need immediate assistance or just have questions, call KLEAN Treatment Centers for guidance. A much better life awaits. Friedman.
Welcome back, everybody, to KLEAN Radio. We have an amazing show going on tonight. We have Dr. Stacy Cohen from an amazing treatment center called Beit. We have, of course, the lovely and talented Andrew Spanswick.
Lovely.
And,
wow.
And of course, right now with our social, what's going on, buds?
Hey, what's happening?
Hey, buddy.
Hey, what's up? So it's pretty funny. So we posted, should therapists work with addicts / alcoholics while they're using? And so I probably should have clarified on the post because some people put, what a therapist or a professional does in their own time, as long as they're not loaded during the session, it's their own business.
Wow.
So that's not exactly what I meant. So, but it's
Right on.
it's
Whatever gets people talking.
Whatever gets people
And
talking.
you did a good job. You actually posted, both of us were posting today about people celebrating their birthdays. And one of the reasons I actually thought about this was the week that Buddy celebrated his birthday in studio.
Right.
And we actually had the guy, Rod Esputo, sitting next to you who helped save your life.
Right.
And I think,
Interventions,
and from intervention and the interventionist. And I think what was so special was watching this. Somebody today, I posted about these birthdays. Somebody goes, 20 years. Thank you, Andrew Spanswick. And that's awesome. It's so important to see. And I'm sure we have Dr. Stacy Cohen. I'm sure you love that when you see people, and you need to see that.
Absolutely. I think that there's so much to celebrate in sobriety, and it's this world that people don't have access to, and it's sad because addiction's all around us. I mean, it's funny that people posted that, but it's actually not so funny because I've worked with professionals, psychiatrists, psychologists, doctors, from anesthesiologists to dentists to surgeons that have had addictions themselves, and so it's not so off actually.
That's why it's always good to know, like, if you're in a meeting and there's a pilot there with 10 years sober, get on his plane. It's the most. If you see your dentist, if you see your dentist at a 12-step meeting, he's celebrating 20 years of sobriety. That's the dentist for you, and that's the people. So that's this hashtag tonight. Is out of the shadows. It's about us coming out and saying out loud, we see it work. It's worked for us. It's worked for me from 10/1/98. It's worked for Buddy. It's worked for so many people. The hashtag tonight. Call us up. That's 800-222-5222. That's 800-222-5222. So this ALS thing is going on where people are doing the ice bucket thing, and that's gone viral.
Yes.
So you keep telling me.
So I keep telling you. And that was part of what I was saying was, and I actually go to our blog, go to KLEANradio.com, we'll look at my blog, because part of that, what I'm talking about this week is in the NFL, they have Breast Cancer Awareness Month. And I know this isn't going to be popular to say. Breast cancer sucks. But in the NFL, so does mental health. I don't remember the last time.
I'd like to see a prostate cancer one, just selfishly there.
Or exactly. Would they have that with Movember?
I mean, I like breasts too, but
Oh, God. Okay. He did just say that. And you just tuned in. This is KLEAN Radio. So give us your calls. Share with us your stories of hope. We need to hear them. We want to hear them. Buddy, read a couple birthdays.
Let's see here.
Or not.
just go with your own, man.
Go with your own. Yeah.
Okay, been clean since June 22nd, 2008.
Right on. Then thank you for coming in, Buddy Todd.
All right, thanks.
And let's get right away. Let's get to Renee calling from Los Angeles. Welcome to KLEAN Radio, Renee.
Hi, thank you so much for taking my call.
No
Thank you.
problem.
I am at the end of a 3.5-year relationship with a meth addict. My God, I love him dearly. I don't have anything left to do but walk away. His life is completely debilitated. The saddest part of this whole thing is he doesn't even notice that. I'm pretty much done beating my head against the wall and being blamed for his entire existence. I can't seem to do anything right, and I don't know. I've like lost my way as well in life. There's not a lot of money involved here to get him some help. He's tried to go to a couple of places that are kind of beaten up, and not the healthiest of surroundings, and he doesn't stay. He stays a day or two and walks out, and I just don't know if there's any help available out there. 3 days, 5 days, something as a jumping off point.
Let me just say, first of all, meth addiction is probably one of the worst addictions that's around right now, and getting people even to realize that they're in a place where they need to get help is extremely hard. And it probably has one of the highest relapse rates of any drug out there, except for probably heroin, which I think is in about the 90% range. So, my main concern, though, is that you've obviously made a choice that you're in an unhealthy relationship. And I think people that end up slowly getting sucked into relationships with addicts don't realize that they're actually developing an abusive relationship with that person, and that they're actually the victim of a lot of verbal and physical, oftentimes, abuse. And it becomes normal because they blame the addiction and not the person as well. So one of the first things I would suggest is that you actually get help for yourself.
Great idea.
Yeah, because you're going to survive if you get help, but if you don't, you're going to get swallowed up into his addiction as well. Also, when people are in a relationship like that, them going and getting help themselves will often sometimes help the other person get help, because they'll be able to set a positive example, and they'll know better how to handle the addict and what the addict's doing and what the addict's saying. What, do you have any suggestions?
Yeah, I could speak from both a personal and professional standpoint. I think that codependency, I'm going to use that term in and of itself, is an addiction. Drug addicts have a codependency with a drug. It helps them cope with things. It helps them escape from things. And I think relationships can do the same thing. And like Andrew said, sometimes actually getting help for yourself and taking care of yourself is actually the better thing for the other person. Sometimes it might feel like walking away would be painful, and sometimes it's just the wake-up call people need. I'm not suggesting that's necessarily what you do, but that's probably the fear in terms of getting help, that might happen. But people often don't realize that simply by making a commitment to living well themselves and taking care of themselves, they can actually create wellness for the other person.
I also find that a lot of people that are in a relationship and then they have to decide to walk away feel a lot of shame and guilt, and that they're giving up on the person, and really that's not the right feelings. I mean, I get that people feel them, and it's right for them to feel those feelings, but that's a perspective that's very internalized, where you're actually taking responsibility for the other person, and you shouldn't have to feel shame and guilt about taking care of yourself as well. So
and addicts and alcoholics have an amazing way.
Right, and nobody
that.
deserves to be abused emotionally or physically. And when addicts get to the point where they're not willing to get help, or they're just there and not willing, it's always important to sort of like leave a door open if they want to get help, and set a boundary saying, you know what, if you're willing to get help, I'll do everything I can to help. But if you're not willing to get help, then I have to set a boundary for myself where I take care of myself first. And then if you get help, then maybe we can discuss re-entering a relationship.
Yeah, absolutely. Sometimes I like to think of the analogy of parenting. When we think of parenting, we think that we know that it's important to set healthy boundaries for your children, not to enable them to continue. I mean, I don't even have children myself, but you just know this, you learn this, not to enable them to continue unsafe behaviors, and you need to set rules. And I think that the same thing applies in relationships. We need to cultivate each other's health and allow people to be healthy. If we don't set those boundaries, oftentimes people go off the deep end, and they can be the most loving, sensitive person, and you can love so many things about them. But love isn't just being there and letting them do what they're doing. Love is helping them get better, and sometimes that means helping yourself get better, so that they have to have that wake-up call.
And let's talk about
how
are we going to get
Renee help? How's she going to get help?
Renee, you're in Los Angeles.
It's one thing to talk about it. It's another thing to get it done.
You're in Los Angeles. You're familiar, listen, there's a bunch of different approaches that you could take right now. Obviously there's therapy, there's outpatient treatment to help you deal with this, and there's going to meetings like Al-Anon. 12-step meetings are absolutely free. But a good suggestion would be, therapy sometimes is so important. So you've been doing this obviously for 3.5 years.
Right.
Andrew, we got to get this woman help tonight. And
please, I have reached out for 3 of the last 3.5 years, and I'm in the same position, if not worse.
Okay, so we're not talking about him.
We've actually just started doing assessments in our harm reduction track at our outpatient. You're in LA?
I am.
Okay, so we're going to put you on hold, and we're doing free assessments for people, and from there we can help you either get help somewhere else or figure something out from there.
Yeah, we're not going to let you have to go through this by yourself, Renee. And
Thank
the
you
courage.
so
I just want to tell you something, Renee. The courage that you have to call in tonight. Forget about, not just helping yourself. I want you to, when you go to bed later, I want you to realize you've helped so many people out there that are going through the same exact thing. And I don't want you to lose touch with us. We're going to stay with you.
I want to say something really quick for everybody too out there is I have set boundaries, and he just walks away and stays away.
Right.
And then I run back.
Right.
Right, and that's why we were talking about you getting
and
help.
I think that's why we get so sick is because, okay, I'm not going to see you until you do such and such. And he's like, okay, fine, I won't do anything.
Right. But remember also, running away is a passive-aggressive act, which, so he's actually being aggressive to you and damaging you by being absent.
And
right, he's punishing you, and it hurts you. You sit there worrying about him.
Right.
So that's a very aggressive act, even though it seems like he's not acting.
I think that's even worse.
It can be worse because there's all that doubt in your head.
Abuse is sometimes far worse than physical abuse because it's.
Well, they're both pretty horrible.
No, that's not. But that's not. I'm not saying they're not. But it's as bad to me sometimes. Emotional abuse.
Horrible. It is.
So Renee,
and I'm like in a nightmare all the time.
Renee, our hashtag tonight was coming out of the shadows, and I got to tell you, you've done that. I want you to stay on hold. We're going to try and get you. We're going to do everything we can to help you.
And Renee, when you come in and hopefully to the outpatient, hopefully I'll be able to drop by and say hi. So
I will. I'll be there. I promise.
Okay. Thank you. Just hold on.
Thank you. I will. Thank you all so much.
Thank you. And if you just tuned in, you are listening to KLEAN Radio. That was Renee calling from Los Angeles. Our guest tonight in studio is Dr. Stacy Cohen from the treatment center Beit with Andrew Spanswick here from obviously KLEAN. And I don't know why I did that, but I love that she.
I don't know. It's our new logo way of saying it.
Yeah.
I guess.
And I love that this woman called up the courage that it took.
Yep.
Because there are so many people like Renee that are out there tonight.
There's so many people that don't reach out because they're so scared.
They're terrified.
Yeah, and it breaks my heart to hear, now it's I think the second caller that felt like there weren't services for people without a lot of resources. And it's actually not the case. It's just that these things are so undercover. Our organization is a non-for-profit. We take a lot of people for nothing or less than $500 a month. I think over half the people pay less than that. We have a lot of people. We probably have the largest rehab maybe in the country, definitely in the area. And I know that this show has helped a lot of people get treatment with very little resources, and there's lots of low-cost psychotherapy centers in the area in Los Angeles. I know maybe nationwide there may be areas that are more sparse, but even just calling in, as you've seen from Renee's example, helps people get connected to those resources that actually do exist. They're just unfortunately in the shadows.
Just so you know, every week Andrew and I get so much slack on Monday, and I shouldn't say that because Andrew's constantly and very much like Beit being Andrew has given away tons of beds.
I mean, we're for-profit, but we give away about 10% of our beds for free.
And that's
and a lot of places do, but people don't know that.
That's at least.
At
least we get, and I think it's important to talk about because you're right. Sometimes it's just also the professional saying getting together, and sometimes saying this place is you could go here and working together.
Right. Well, other people don't realize that non-for-profit and for-profit is just a tax exemption. It's not necessarily what the morals or values or purpose and mission of a company is or a treatment facility. So I think it's important that people shop around and they actually talk to people that have been to other places and been to the treatment center they might be thinking about going to find out if it's really a match for them, because they're all very different. There's a lot of different ways to treat addiction, and there's a lot of different personalities out there. And so, I'm one that's, we're pretty much full all the time. So for me, it's like, I want somebody that really wants to come, somebody that we're a good fit for. I'm not just out there looking for patients. So, and
I know neither are you a Beit and that's Dr. Stacy Cohen, but I want to get to this call. Let's go to John calling from Los Alamitos. Welcome to KLEAN Radio, John.
Oh, hi. How are you? I've called a few times before. I've got that 21-year-old who's been in and out of rehab since 15, 4.5 times. Okay.
Yeah, John, how you doing?
Good. I'm doing good. I just wanted to bring up a point. my son, who still hasn't entered rehab again, of course, I've been going to Al-Anon. You guys suggested that to me, 6-7 weeks ago.
Mm-hmm.
And anyway, I tell my son, oh, yeah, I go to Al-Anon. And it's got him, it hasn't driven him to go to rehab yet. I think it's slowed him down, and it's made him stop and think. He's sort of like, how come my dad's, I'm not even in rehab myself, but my dad's going to Al-Anon. So anyway, I'm just wanted to share that and promote to people whose children or whose spouses, won't get help. At least you got Al-Anon, to kind of give you a hand to try to get through this.
I think that's really interesting. And, one of the biggest problems we have with people that are addicted is denial. They don't really think they're addicted, or they think they can control it. And when they see other people actually doing what seems like pretty aggressive and drastic actions, like going and taking their own private time to get help, it's sort of like, wow, if Dad has to actually go to Al-Anon, maybe I really do have a problem.
Right.
Yeah, and I think it also drives into the point that addiction does affect all of us. We no one has a problem getting on the air and saying, I have breast cancer, help me, let's raise money. But when it comes to addiction, it's a lot harder. And the fact is, just like when people have cancer, the whole family is affected and the friends are affected.
Like our first call, the woman who'd been widowed 3 times. I mean, those 3 very traumatic events. And yet she's dealing with some of the same problems that people deal with addicts.
Absolutely.
That, how do you reinvent yourself? How do you create a new life? How do you survive?
Yeah, I mean, I alluded to the relationship I was in. I was the one who went through recovery, not the other person. And I think the fact is recovery can be for everyone. The woman talked about reinventing herself. And the tagline at our residential center is recover your purpose, discover your passion. And we know even from a neurobiology standpoint that altruism and finding purpose and doing something that feels good, it actually increases your dopamine in a healthy way. And these are things that aren't talked about.
Right.
It's medicine.
It's not talked about. We actually, I'm not going to pat ourselves, but it's something we actually talk about a lot, is getting active. It's a big reason why we've decided to do this. We've been doing it throughout the summer, this bowling league, and where we sponsor it for...
Yeah, me getting a 31 really wasn't good for my self-esteem. But
I told you could use bumpers next time. And but
there are solutions, that's right.
But how much fun is it? And I love watching people when I tell sober people to come, they're like, but I'm not very good. And I'm like, none of us are.
I'm the owner of KLEAN gets a 31.
So,
you can't do worse.
But it's so important, like you're talking about, Stacy, it's so important to get active. It's so important to get commitments. And, just to become among life.
Yeah, absolutely. And sometimes people say to me, but do you really have fun with sober people all day? And I said, these were the biggest partiers there were.
Yes.
First of all.
And Andrew, what do you always say?
Hey, you still got the stories. You still got...
No, but you always say it at a restaurant.
The loudest table in the restaurant is normally the people that aren't drinking.
Yeah, and it's always... It really is. It's the sober people. And if you just tuned in, you are listening to KLEAN Radio. Oh, I just realized, John, are you still there?
Yeah, I'm still there.
That's how much fun.
He's a good listener.
John, I want to tell you something. So she's with Beit. We're with KLEAN, obviously. Whenever your son's ready to get help.
Yeah, and John, I'm so proud of you for doing the work.
It's really amazing, and I love. And can I tell you, John, what I love about, because I have this image, and people, what I think is so important in this is just like Renee was calling in and had the courage. John's a man, and this image of Al-Anon sometimes is women. It's and the courage that it takes for a father, for a man, to go to Al-Anon and say, I don't know what's going on. I don't know what's wrong. So for people out there that are listening, it's working for John.
Yep.
And John might find out things about himself. Yeah.
You don't feel like you're alone. You're not on the boat in the dark alone. You're with other people. So
get out of the shadows. That's
maybe
right.
that will rub off on your son, who probably feels very alone.
I think it already is.
Yeah, it sounds like it. It sounds like it.
I think it. I mean, as I say, it's got him to stop and think. Why is my dad? You want to Al-Anon again to another meeting? Anyway, I'll let you go. Thank you all very much.
Thank you, John.
Thank you.
I think it's also important for people to realize, and we've talked about this a few times on the show, but that this is a process. You don't just say, hey, you're a drug addict, and then you stop being a drug addict, and that's the end of it. There's a lot of damage done while people are actively using, both with family members and people around them at work and other consequences that might occur. And, getting sober is sometimes the first part. And a lot of times the reason people relapse is because it is so difficult to go back and deal with all these past traumas that they've created with other people and deal with the anger that people have towards them from them being addicts. And that's one thing that, we try to work a lot with KLEAN is that, working through these family issues and working through in a very limited amount of time, but it takes years sometimes to fully recover. And, and it's still an ongoing piece of work. It's not something you just do one day and you're done,
Yeah, absolutely. So. Sometimes we end up saying to the residents, it feels like we're working harder than you are, and that's what that story with the father reminded me of.
Yeah.
And I love that, it's great hearing. And if you just tuned in, you're listening to KLEAN Radio. Our hashtag tonight was Out of the Shadows. And I think our callers really displayed that of getting out of the shadows. You're not alone. And our next caller who's calling to check in also has, let me read this correctly, 15 years, 11 months, and 5 days. But who's counting? Let's welcome back, as always, to KLEAN Radio, Heather.
Hey, Heather.
Hi, Heather.
Heather. I had to hit the button, Heather.
Oh. Hey, Heather. How you doing?
I'm doing okay. I was really, shocked and saddened about Robin Williams. But one of the things that I've gotten out of the past week is that a lot of really positive things can come out of horrible things.
That's absolutely true.
With the amount of, links to suicide lines and mental health awareness, and, now the awareness of Parkinson's disease, in addition with depression.
Well, did you hear about the thing with Gene Simmons and Kiss? Did you hear about that?
No.
So Gene Simmons made some comments about how, like, the people that are depressed or do you have the exact quote, Judah? It was like people that are depressed.
Yes, the Kiss. Which one?
Yeah, which one?
After Gene Simmons suggested, if depressed, then kill self. Here's the deal with Gene. Then that's exactly what Gene Simmons said.
Yeah, he said his mother was in the Holocaust. He doesn't want to hear about people complaining. And if you're 20 years old and from Seattle and you want to kill yourself, you should just go jump off a bridge. Yeah. And it's like, wow. But what's interesting is how people have reacted to that, and they've now banned
radio stations are banning.
They've dropped his. Yeah, they're not playing his songs, and they realize that there's some social responsibility. And then Nikki Sixx, actually from Motley Crue, came out and said that if it wasn't for the fact that he got through his depression, his drug addiction, his 4 kids would never have been born. So, and that he totally disagrees with Gene Simmons. And I think that's really the point, is that there is life after, real trauma, real depression, and real addiction.
And it's so much more. That's the thing. It's like Nikki Sixx is talking about.
And for Gene Simmons, who's a sex addict, I mean, him
and Ted Nugent are very similar on that.
Right? They don't drink. They don't do drugs.
It's almost like they became evangelicals, just with not. No offense to evangelicals, but Heather. So I saw that your niece was in town visiting.
Oh yeah. Yep, I corrupted her. I had her watch Princess Bride and introduced her to Weird Al.
Hey, that's really cool. And that's one of the cool things about this sober gig, is that you get to be an aunt to your niece.
Weird Al just came out with a new album.
Yes, he did. It went number 1. Yeah.
He never stops.
All right.
And why should he?
Yeah, right.
You know what?
There's plenty of people to make fun of.
Let's burn those Kiss albums. Let's just buy Weird Al Yankovic. And so, Heather, I want to thank you for the update.
Yep, and also with the ALS challenge thing, I was really excited. Did you see the link where, last year they only made about $1 million at this time period, but they've made something like $7 or $11 million.
Wow,
because of the ALS water challenge.
That's amazing.
Yeah.
Otherwise known as Lou Gehrig's disease.
Yeah.
So Heather, thank you so much.
All
But
right,
again, Heather, before you leave, remember, I'm jumping out of a plane and parachuting into Andrew's wedding for the mental health challenge.
That's right.
And I challenge everybody in America to jump out of an airplane.
Oh, be careful.
What, into my wedding?
Not into Andrew's wedding. Into different weddings. Just be careful.
I don't know if I can afford that many
you know
seats
what,
at the
Andrew,
table.
for mental illness, we'll do it. We'll figure out a way.
Right. It might be macaroni and cheese, but
that's exactly right. So Heather, thank you so much.
All right, bye-bye.
And if you just tuned in, you are listening to KLEAN Radio. We've had an amazing show tonight. We have Dr. Stacy Cohen from the amazing treatment center, Beit. We have Andrew Spanswick, and of course we have me and
the Judah.
And one of the things I think is really cool that you both have been talking about, and you guys started the show with this, is that therapists can work together. Treatment centers can work together. And I think it's so important sometimes that people realize that.
Yeah, I mean, I think any treatment center is doing a good job. Pretty much has a full census, and there's more demand than supply. So it's really just an issue, I think, of working with the right people. And I think one of the things that we're seeing is that this industry is developing. It's growing out of a very sort of mom and pop, somewhat organic self-help sort of model into a much more sophisticated medical model. Although it doesn't ignore those other elements, the social models are still very important. But I think that, what rehab was 10 years ago is not what rehab's becoming. And with, science and technology and a lot of work by a lot of very smart people.
Like our guest.
Yeah, that we're getting to the point where treatment's getting better and better, and there's more and more hope. And hopefully that will continue.
Yeah, absolutely. And actually, on the cover of the Psychiatric News magazine this week, there was a whole article about how faith leaders and doctors are coming together to create better treatments for addiction. And I think that, the medical model is really helpful for some because it helps them sort of find a place when faith doesn't speak to them. And faith used to be a big part of the model in the past. And then I think if you go too far in the medical model, then you sort of maybe get lost and aren't looking at the soul piece. So I think that both are very important, and I think that there are also there's options for each individual these days, which there weren't always. And so some people have these kind of gut reactions when they hear rehab and they think it's a certain way. And the truth is that it can be individualized to different people's needs, and there's a variety of them for that. I also wanted to talk a bit about the harm reduction thing that's come up.
We're going to have you back on the show.
Oh, okay.
We're already asking you on a second date, and I know Andrew is totally okay with that because you geeky. What magazine was that you were reading?
Psychiatric News magazine.
Whatever it's called.
Andrew
is the happiest man in the world right now that we had a guest on that subscribs to Psychiatric News Weekly. And we will get back to you. I wanted to get to a couple clips, but first one is Tony Shalhoub.
I had the privilege of knowing him a little bit, spent some time with him, called me by my first name, which I considered a great honor. I always dreamed of having the opportunity to work with him. He was an inspiration to all actors, and he will be sorely, sorely missed.
And that's Tony Shalhoub. Patrick Kennedy and Rand DeWitt are crack reporters, crack director, crack producer. The best thing about KLEAN Radio sometimes, yes, actually went down to Royce Hall this week and interviewed them. There were so many people, and talking about Robin Williams. The thing we're talking about tonight with Dr. Stacy Cohen from the amazing treatment center at Beit and Andrew Spanswick, of course, is that there's so much hope. To the people out there that just tuned in, it's so easy to get depressed sometimes when you watch the news about addiction and mental health. But you know what? We posted on Facebook today, everybody, and I didn't get to read all the birthdays, but this is what we're going to do, Andrew. We're going to go back on and send to everybody that sent their birthday, we're going to send them a KLEAN Radio shirt.
I think that's a great idea.
And I want to get their pictures with a poster of them saying their sober time. And I wanted this to be a thing. And Monique Moss, our publicist from Integrated PR, is going to help us with this. This is our mental health challenge. We're calling all the people out there to get out of the shadows, to all the people that are recovering, that are sober, to stand out loud, to stand proud, and to say, I want to get better. And I want to just thank everybody that helped the show. Dr. Stacy Cohen, how do people find you?
What's that? So beitteshuvah.org is BEITTSHUVAH.org, and my website's stacycohenmd.com.
I think Judah was looking for your home address.
Oh.
That's later. That's for show number 2. And if you just tuned in, thank you, everybody that makes this all possible. To everybody out there that's in the shadows, it's time to get out. KLEANradio.com. The discussion continues. KLEANradio.com.
Are you or someone you care about addicted to drugs or alcohol? Addiction ruins lives and destroys families. Bring an end to the pain and suffering by calling KLEAN Treatment Centers. KLEAN has helped people from around the world break free by not only treating the addiction, but the underlying causes and providing vital aftercare so people can get clean and stay clean with no gimmicks and no false promises. If you need immediate assistance or just have questions, call KLEAN Treatment Centers for guidance. A much better life awaits.